Hi, everyone. My name is Leah Hill, and today I'm going to be talking to you about alcohol use disorder in older adults, understanding the problems and solutions when working with this population. This is a topic that is very near and dear to my heart. Um, One, because I identify as an individual in long-term recovery from alcohol use disorder. But I also work in an ambulatory outpatient clinic that addresses and helps individuals um, manage and reduce the harm of their substance use disorders. So this particular topic with our older adults population is really important for a number of reasons, which I'll get into. So first, 10% of older adults engage in risky drinking. So this can include things such as drinking on various medications or with various health conditions, which could be exacerbated by the inclusion of alcohol consumption that may put them at a higher risk. 20% of hospitalizations over the last decade uh, for our senior population included alcohol-related reasons. So 1 in 8 cases goes undiagnosed due to overlapping symptoms with aging conditions. So what people may see or maybe have a bias for when they are presenting for a checkup with their primary care physician, or perhaps they present to the hospital, assumptions and biases can indicate sometimes that people and providers aren't necessarily looking for or considering the inclusion of alcohol use in the health conditions for older adults. Um, so that being said, they may assume that a fall was related to stability or mobility issues. They may consider that any type of like memory impairments may be uh, particularly attributed to the aging process, as opposed to the it being basically a result of impaired memory functioning because of alcohol consumption. So some of the challenges that we see in diagnosing alcohol use disorder in the older population is misdiagnosing the symptoms as either depression or dementia related because of the overlap of those symptoms. We see that there's a high risk of falls, of medication interactions, and cognitive decline. And I think most especially that can be a challenge is the limitations in social support for seeking treatment. When we kind of zoom out of the picture in the context of substance use disorders and alcohol use disorders overall, we see larger societal challenges. These include the stigma that is oftentimes it is almost always attached to any type of alcohol use disorders or other substance use disorders. Um, so that could be for the providers and also for the individual and the older adult who may be experiencing, heavy use of alcohol. Nobody wants to be stigmatized or feel as though we're inherently bad or we should feel ashamed of how we're using these substances, especially if we have all the indications of a use disorder. Um, that being said, so much of substance use disorders and alcohol use disorders are shrouded in shame and secrecy that help to perpetuate the stigma across our communities and within the broader society. Additionally, there are the medical comorbidities, as was mentioned, right? Like the comorbidities between symptoms of depression and dementia, or also anxiety, or physical manifestations, like maybe they're having liver problems, maybe they're noticing gastrointestinal problems, which could be related to pre-existing conditions and also could be a direct result as well of alcohol use or heavy alcohol use. And then, of course, the social isolation. Uh, this across all use disorders and alcohol use disorders across the age spectrum is very real, but particularly with our older adults. Um, if they're spending time alone or there's limitations or decreases in their access to being actively social and connected with family or friends or in some type of community, then we're going to see an increased risk for the use of alcohol, which may then exacerbate these other things. So, all that to say that all of these, the stigma, the medical comorbidities, and the social isolation contribute to the underdiagnosing and undertreating of alcohol use disorder in older adults. So, what can we do? Well, there are some screening tools which have proven to be relatively helpful. Actually, here we go. So, some of the screening tools that can be used for the identification of alcohol use disorder in the older adult population include the SMAST-G. So that's the short Michigan alcoholism screening test, geriatric version. We also have the CAGE questionnaire. The CAGE questionnaire is a relatively brief screening tool, just asking about like frequency and quantity and what else they may be using. And then, of course, if you're in the school settings, you may have heard of the SBIRT, but it can be used across various uh, treatment or housing or community settings when you're working with the older adult population. So SBIRT screening, brief intervention, and referral to treatment. So things to consider as an older adult may be showing indications that a further assessment would be required to determine if they have an alcohol use disorder. Couple things to consider in that process. Um, it's so important that anyone who is working with the older adult population differentiates between the late onset of alcohol use disorder and early onset of alcohol use disorder. So, most importantly, if it is a late onset alcohol use disorder, we want to look for and be concerned about the degree of tolerance that the elder may have for the alcohol. This is because there are only two substances which can prove fatal in the withdrawal process when we are detoxing from those substances: benzodiazepines and alcohol. Uh, so how they would be treated if they had late onset AUD means that they would require medical observation, with the inclusion of like a full medical team to support them in the detoxification process and to watch out for any significant um, withdrawal symptoms such as like delirium tremens and grand mal seizures. So now if it's earlier onset, we are still looking for the degree of tolerance that an older adult may have for alcohol. But we may be able to intervene at a different point in time, or using different modalities. So speaking of interventions, I did mention, but did not put on here, the medical intervention that would be required for someone who has a very high tolerance or dependence, physical dependence, um, to alcohol. Um, but even so, after that, there are particularly CBT, motivational interviewing, and craft interventions. So CBT, I think a lot of us are familiar with it, is long been used to help to uh, older adults to identify and make connections between the cognitive, uh, emotional, behavioral uh, process that plays out their continued use of alcohol. Um, Motivational interviewing is associated with the trans theoretical change model. It's very helpful when we're working with any individual, and particularly older adults in this case, to be able to identify where the older adult is in their change process. Are Because the approach that we may use is going to be contingent on where they fall. If they're still in pre-contemplation where they're going, I don't have a problem. I've been drinking for like the last 50 years. You guys are making a fuss about something that's not a big deal. How we're going to intervene with that individual is going to be different than one that is saying, hey, like my drinking is really starting to impact my physical health and my memory. And I don't like that. I just don't know what to do about that. Uh, that person may be at the point where they're moving out of contemplation and moving into the preparation stage. And then we have the craft, so the community reinforcement and family training model. So this is where we want to build in those buffers to combat the social isolation. It also takes a more holistic and systemic approach to the recovery process with our older adults. Um, and that is so important that because of the shame and secrecy that is often tied to alcohol use disorder, it's so important that we get them connected to and with members in the community, family, and with providers that can support them on whatever their recovery journey may look like from alcohol use disorder. Additionally, there are medications for alcohol use disorder or MAUD. This can be naltrexone in the form of a pill, that best known as Revia. But then there's also Vivitrol injections as well. That is just the injectable form of naltrexone that it's a once monthly long-acting injectable, helps to stave off the cravings for alcohol and also the effects that may be produced if they were to drink alcohol while using this. Camprol is also an additional medication that can be helpful in the process, and as well as antabuse, disulfiram. That one, it can be more helpful when somebody is very motivated because it requires the individual, or in this case, the older adult, to really electively use the antabuse each day. Unfortunately, or maybe more fortunately, if this is the particular medication that somebody is going to use to address their alcohol use disorder, the antabuse is going to make them physically ill when they drink. So just some other considerations. And of course, these are conversations and decisions that would be made with the medical providers in the overall treatment process. So some things important to know. I live in the upstate New York, Rochester, New York area. So there are fortunately a whole bunch of local resources here. We have our Lifespan of Greater Rochester that has a recovery and wellness for older adults program. Again, building in more connections. We also have adaptations for adults in Alcoholics Anonymous. I personally am an active member in AA, and having talked to many elders who have been around for some time, there are a few meetings where it specifically draws in our older adults, which is very nice and very cool because yes, while we have them for like young people and like LGBTQ and men and women, of course, our older adults can share that space where they have the shared life experiences all together. So that is cool if an older adult is interested or willing to look into Alcoholics Anonymous. I'm going to put a plug in for where I work at URMC Strong Recovery, which is part of the University of Rochester Medical Center. There's Strong Recovery, that is the outpatient treatment program that I work for. However, we also have an outpatient older adults clinic that also has a case act there who is integrated and can help with that population. They do things like mental health therapy over there, counseling, case management, just a whole number of things specifically targeted to our 65 plus population here. There's also the Monroe County Council on Aging for additional information and support, and the Monroe County Aging Alliance. Within the state of New York, if you are here, then you very well be may very well be familiar with our Office for the Aging that oversees a ton of programming specifically for older adults. And then our Office of Addiction Services and Support, better known as OASIS, they oversee all of the treatment levels of care for the treatment of substance use disorders, including alcohol use disorders. And for further information, there are the federal agencies. These include the Administration on Aging, SAMHSA, our Substance Abuse and Mental Health Services Administration, the NIH National Institute on Alcohol Abuse and Alcoholism. We have information that can also be gathered and looked for via Medicare and via Medicaid, who can help to identify various options for supporting an older adult who is looking for some sort of treatment or recovery path for their alcohol use disorder. The biggest thing to remember in the treatment of addressing alcohol use disorders in our older adults population, and it's true across the board, regardless of age, regardless of intensity, is that hope and healing are always possible, and we can find recovery at any age. So I do have some more information in the references, but I appreciate you coming and talking about a topic that is so important, because there's still a rich quality of life that can be on the other side of this, regardless of how long an elder may have been using or living with an alcohol use disorder. So thank you so much for stopping in, and take care.